In this video, I am going to be speaking to Dr. Andrew Perry, a clinical psychologist for 25 years. He helps people with anxiety, depression, anger and relationship problems, and severe mental health issues. In this video, we will discuss how anger fuels depression, about triggers, and more. So please join us. Hi, Dr. Perry, Andrew, and thank you so much for participating in this interview. I really appreciate it for you being here. And so I know you've been a clinical psychologist for almost 25 years, right?
Yes, nearly. I've been in mental health for 25 years. I've been a clinical psychologist for, that's a good question. I don't know now, 17 years.
Awesome. Okay.
Yes.
And so in your view, as working as a clinical psychologist, how do you support patients that are going through trauma and through depression that's perhaps like different from other people in the field? Like you have a special therapeutic approach?
I can't speak to other people in the field. I suppose that's the first thing to say. I suppose, and I wouldn't say my approach is special, but it to some degree it's particular to me, in as much as any approach can be, because you've got to. All professionals have to practice from an established body of practice. So in order to practice in a particular way, you need to be able to evidence, well, it isn't just what I think or what I do. There's also other people that do it. And there's also, what would the word be? There's evidence to support it. So it's based on, well, I suppose theory and evidence for what might work with people who have trauma and depression. Mm-hmm. Does that make sense? So we're not trying to reinvent the wheel, but I suppose individual clinicians are trying to make a better wheel. Does that make sense? They're trying to make one that runs better over the territory of trauma and depression, to use your example. But I'll try and answer your question a little bit more. I suppose trauma and depression to me are two separate things. They may be related. They may interact with each other. Depression may be traumatic. Traumatic events may lead to depression. They may occur together, they may occur separately.
That makes sense.
Go on. So I suppose I would take my primary approach would be what we would call transdiagnostic. Now that sounds very fancy, doesn't it? But basically what it means is that the diagnosis influences, but is not decisional on the approach that is taken. Does it make sense?
Okay.
So if I come across someone with depression, then
yes, I was going to say, give an example for the listeners to understand.
If I meet Jim, who's got depression, then I will refer to well-known theories and evidence around depression and what might work for him and what works for other people. But it doesn't. It's a context rather than an instruction book, because the theoretical model is that Jim has the depression, and that Jim's experience of the depression is important in terms of how Jim is going to get out of this depression, how Jim is going to live alongside this depression. And so we begin with the phenomenology. So what's it like for Jim to have depression? How does he interact with the depression? How does he make sense of it? How does it fit in with his other experiences of life today? So both trauma and depression, in my mind, by my understanding, tend to be novel phenomena. What does that mean? I'm using all these long words. I apologize.
No problem.
Tend to be new things. Mm-hmm. So tend to be new things. So depression, we would think, well, I was taught that depression overlays an individual's personality. So generally what happens with depression is somebody is getting on with their lives and then they become depressed.
Yes.
So and then it overlays the pre-existing personality, and to the individual is new, and hence is a new experience, and hence to the individual, there may be, as with all new experiences, that there is a process of what we would call adjustment. So adjustment to this new experience. Well, I used to be Jim without depression. It doesn't have to be Jim, of course. It could be Jane.
Yes, yes.
This
Just
isn't
anyone.
gender. It's just I'm using the thing. But
Exactly.
there's a period of adjustment to this additional reality, this new reality that this person is experiencing, and that's got a huge overlap with trauma. Because the way I understand trauma is that something has happened to us that is very new to us, very, very new, and it's so new that we struggle to adjust to it. And yeah, we struggle to adjust to it. And reactions to trauma are, I would think, are primarily adjustment reactions. Does
Yes,
that make sense? So this
that
is where
absolutely makes
depression can be
sense.
traumatic in that it is new and can be disturbing and can be difficult to integrate into our past experiences, but also that trauma can lead to depression in that in adjusting to another event, say for instance a bereavement or any traumatic event, anything that's shocking and new to the individual, can lead to difficulties in adjustment, which can then make us more predisposed to depression.
Yeah, absolutely. You're saying it's just basically you're adjusting to a new reality. Before
Yes,
you
and a
had the
new reality.
depression, after you had the depression, so your
Yes, but
personality
it's
is
it's
going
not
to,
it's not
yeah,
it's not just new. It's new and it's unexplained.
unexplained, and it can impact, as you
Yes,
say, one's personality can change, one's outlook, and basically a new way of living and adjusting, adapting
yes,
to your new world,
yes. And
new world of
I suppose
depression.
what my job is. Well, why are you along there alongside? Why would anyone pay you money to do this? Well,
Yes.
my job, I suppose, it partly is I suppose the experience of these things in a personal sense, but and professional training. In that, I suppose I would that it's not new to me.
Hmm.
So people will come to me and they'll say, "Oh my word, blah 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 blah," and I'll go, "Well, yes, yes." One thing I often say to people with depression, I don't know whether we mentioned this in our pre-chat.
Hmm.
Welcome to the club, I say to people.
Yes. Yes.
Welcome to the club, because the club, of course, is quite big. Once we start to research
Hmm.
depression, we realise how many people are in this club, how many people in lots and lots of different societies across the world experience these, to some degree, unexplained shifts in mood, unexplained shifts up and down in mood that are, well, that aren't just simply in our control, that aren't things we can just shake off or just wish away.
Hmm.
And
Absolutely. And so that's what I was trying to basically get at if somebody is reaching out to a clinical psychologist, what your role is. And
yes,
you
so we
have
start to think,
described
go
it
on,
as
we start to
opposed to
think
a
about,
social worker or something.
yeah, so we start to think about normalizing it and start to think about, well, what explanations make sense. And so when you were saying what's your therapeutic approach, it really starts from where the person is. So
Hmm.
really kind of one of the things you would say is, well, what have you tried so far? Or how do you understand what's happening to you? That the person, we will naturally make meaning of what we're doing. It may have a particular meaning in a particular family or a particular culture.
Hmm.
When someone is feeling down, when someone is feeling sad, there may be a particular response. There may already be a story
Yes.
within a family or within an individual what it means when they experience depressive symptoms.
Okay. And going
And
upon what you just
go on.
stated, Andrew. Oh, I'm sorry to interrupt if you needed to continue on that
No.
point.
But the only part was, I think it feels like we're on the same track. And my job really is to add potential explanations to that, to make that story more useful. Okay, so to think about ways of considering, of interacting with this new phenomena, whether it's depression and or trauma,
Hmm.
that might be additionally useful. So it doesn't say, well, hang on, your explanation is rubbish. Mine is much better, and I'm going to tell you, and I'll keep telling you until you agree with me, and you can repeat it back to me. No, this is all very, very old school stuff. How
Okay.
psychologists work now, and how I work in particular, is that there are multiple truths. There are multiple reasonable explanations,
Hmm.
all of which can interact and add to a better overall explanation, and most importantly, a more useful explanation and a more useful pattern of interaction with the symptoms for the individual. Does that make
Okay.
sense?
Yes, it absolutely does. And going upon the comment you made about family, I know, Andrew, that you have personal experience with the depression and also your father's struggle with it. So, coming from a background and a place of personal experience, you can relate probably to your patients or to your clients or anyone. Can you share with listeners briefly your experience and your father's
Sure.
and how that perspective has changed you in helping others?
Yeah, yeah, and I suppose that's why I'm in this business. That's why I'm in this business, because I remember as a
Good.
little boy, my dad had a breakdown. I can't remember if it was 12 or 13, but he came back from some course,
Hmm.
and he was manic. He was mad in colloquial terms. He was intensely disturbed. He was pressured in his speech, in his mind, and yeah, he got admitted to psychiatric hospital, and this was a huge shock. I think
Hmm.
probably up to this point, I was probably very sheltered. I think at this point, do you know what I mean? But the idea that my dad could lose his mind, could become very mentally unwell to the point at which he has to go into hospital and stay in hospital away from us as his family.
And how old were you by chance? I was just wondering
I
how
think it
old.
was 12 or 13. I can't
It
remember
was 12,
the
13.
exact
Okay.
date. Yeah, yeah, yeah. But I was young, and I probably was a young 12 or 13 as well, and kind of. And it wasn't just that. It wasn't just the shock of it. I suppose you would say the trauma of it, because it was new, to place it in the kind of context of my answers before. The
Yes.
trauma, oh my word, what's happening? I remember looking at pictures of my dad, and it's like he died. So looking at pictures of my dad before he went into hospital, and it was yeah, where had this kind of content, happy man who was available, who was part of our family, gone? And yeah, and
Mhm.
this kind of grief for him, because it wasn't he just went into hospital, he then came out of hospital, and he wasn't better. He wasn't better. He wasn't
Mhm.
manic anymore, but he was still significantly depressed, and still withdrawn, still changed, still with low mood, still isolative, still angrier than before.
Mhm.
And as a well, yeah, and as for me, the effect that had on our family, and the yeah, well, it whoa.
And as you as a kid, because it's probably a hard concept to grasp, and how was it explained to you by your family? Because at that age, you don't
Well, I'm not even sure
understand.
if it was explained to me
Oh,
by my
okay.
family. I certainly don't have a memory of an explanation. Certainly, there was an idea of dad not being well.
Okay.
Yes. But was there an explanation as to why dad wasn't well or isn't
Yes.
well, and why
Why?
dad doesn't get better? Yeah, there was never a sufficient explanation, or an explanation that was sufficiently helpful. And I suppose as a little boy, why can't I make dad happy? Why can't I cure my dad from depression? Do you know what I mean? Why can't, if do you know what I mean? If
Oh,
I make his favorite tea, or if I, do you know what I mean? Whatever
yes.
it is, do things that he likes. You know what I mean? Take him things that he likes, or buy him things that he likes, or spend time with him, or do you know what I mean?
Mm.
Try and play with him.
Did you
Why
find that
doesn't
it,
this work? Why doesn't this work? Go
did
on.
you find as a child that there was a lot of guilt, self-blame, thinking that, oh, it must be my fault that my father
Well, it
experienced
wasn't so
this?
much guilt and
Because
self. It wasn't
you're
so much.
personalizing it. Like
It
thinking, did
wasn't so
I
much.
do something wrong?
Yeah, yeah. Well, it wasn't so much guilt and self blame. It was much more that it was painful that I couldn't do anything about it. There was
You
a real
couldn't do,
strong,
yeah.
yeah, that there was more helplessness. It didn't make sense to me that it was my fault, because it didn't make sense to me at all. So I couldn't conceptualize how I would have done it. Does that make sense?
Yes.
I wasn't blamed by anyone, but there was this huge phenomena that had massively changed our family that I couldn't do anything about, and that was really, really difficult.
Yes.
And
Especially as a
so,
child, where you feel like, okay, it seems like there's certain things in my life
well, in
I
one
don't
way,
have
our
control.
family ended at that point, or one version of our family ended at that point. And well, that's my experience. As a sudden, I suppose, how does it relate to my practice now? It's well, it's real to me. It's personal to me. Yes, it's personal to me. It is personal to me. Yes, I
And
don't like mental illness. It's a funny thing to say, isn't it? But I don't like it. I don't
yes,
underestimate it. I
I don't think
don't.
anyone does, especially going through
No, they don't.
personal
No, no, no. But it's a different.
family
If it's not
experience.
affected you directly, then it's an idea, isn't it? For me, it's an idea, and it's an experience, and it's a direct experience, and it's a memory that is well, this is worth doing something about. This is worth spending my time on, because it's significantly problematic for the families that it affects.
Absolutely.
So
And
whenever I see somebody as an individual, I'm also indirectly trying to help, the rest of the family, who will be inevitably affected by the individual's symptoms and the change in them. So
absolutely, one person it impacts everyone around them, whether it's family, friends, or whoever the core people are in somebody's life. And also, I know you've had a personal experience. If you want to
And then of course
briefly,
I then become a patient. Eventually I
briefly,
become a patient, and well, being a patient is very interesting, I would say, and it's very interesting, especially
yes,
um, for people who are, or who go on to become, or who were healthcare professionals, because there is there are two separate and there are two separate worlds. There is a world where I'm a healthcare professional, and there is another world where I am a patient with a mental health problem under treatment since 1997. And obviously they are the same world, but they are and they aren't, because people you understand the system within which you are working with, again,
yes.
in an additional personal way. Do you know what I mean?
So you were practicing at the same time, experiencing your
All
own
the way
challenge.
through, yes. Goodness me, yes, all the way through, yes. And
But at
well,
least you can,
and again, I suppose there's something. Well, what is possible? I spoke to someone the other day. What is possible in life alongside depressive symptom, alongside significant chronic mental health problems? What's possible? Do you know what I mean? And that.
mhm. Well, that's good. That
And
definitely
that's
shaped you.
that's an experiment to be tested in each of us. In each of us, we can only know, but again, another another part of my approach is we only find out by trying. And
Yes.
one of we have to try, and particularly we need to try. We don't have to try. That's the wrong way to put it. It's often helpful to try, in depression, because in depression, my experience is that the table is tilted towards pessimism. Most people with depression, the glass is half empty.
Well, of
And their
course.
prediction, yes, of course, you say it, of
That
course,
makes sense.
but you say it, of course, but people forget. And they
Okay.
forget, especially if we're depressed for a long period of time. And I'd forget, I'll be straightforward. That the table is tilted. And so our predictions about the future are often more pessimistic than the probability of them. Does it
Hmm.
make sense? And so if I'm sat there and I make consistently pessimistic predictions about the future, well, the odds are I won't go and do those things, because I've decided they're not going to work already in my head as a symptom of the depression. And so what I'll say to people with depression is, well, it's even more important now that you try things, that you test that hypothesis. You test, well, go and do it and see. And if it's terrible, you don't have to do it again, but at least go and see. We'll see and see
Hmm.
what's possible. How do your symptoms respond to going for a walk, ringing up your friends? Do you know what I mean? Eating a different kind of meal, going to bed at a different time, taking a different medication, whatever it is.
Hmm.
Well, give it a go. Do you know what I mean? And in giving it a go, testing the hypothesis, we say in very fancy terms, we're a bit closer. We've got another additional piece of information of which to tackle this problem, to get familiar with it. So it's not new anymore. It's something we're familiar with and have an evolving way to interact with that is useful to us.
Yeah, that makes sense. It's about just trying, whether you feel capable or motivated or not. It's just a matter of doing it, and you can stop if you don't like, or
Giving it a
whatever
go.
it
And then
is.
it's not saying you have to get it right. It's not saying there is a set way,
No,
but something about trying in depression is really important,
absolutely. And this
because
gets,
it gives us additional evidence, as well as the evidence of our thoughts and our
mhm.
feelings, that that are clouded and colored by the depressive symptoms.
And this leads to our next important topic in depression is that key word, that powerful word called triggers. If you can explain to listeners what triggers are, and I find that there are two types, emotional triggers and situational. If you can give examples of both, because I hear it all the time. I've experienced it. I'm sure you have. It goes side by side with depression.
Yes, and how to put it? I suppose one of the things to remember is that in depression, we will have different triggers than outside depression. Okay, so when you look at studies of depression, that we are predisposed, of this tilted table again, to remember unhappy events. We're predisposed to remember sad events. So you get someone with depressive symptoms, they will find it easier to remember sad events in their life than someone without depressive symptoms. And the opposite, someone to remember happy events will be harder for someone with depression. Does it make sense? So the triggers are the what's the word? The dice are loaded in depression. So the triggers to upsetting memory, upsetting feelings are loaded towards almost like a confirmatory bias. I don't know if you've heard of confirmatory bias. So a way of looking at the world that confirms to us, well, it is right to be pessimistic. It is right to feel dark about the world because horrible things happen. And I can remember all these horrible things happened. And
So how would you distinguish between an emotional
I wouldn't distinguish between emotion
and
I
situational?
I wouldn't. But then the
You
reason I
wouldn't.
wouldn't, no, because to me, a trigger is that, well, what would I say? It's
Because
post.
you know how
Go
I
on,
look at it as, oh, I'm sorry, Andrew, to interrupt.
go for
Like,
it. Of
this
course.
is how I distinguish triggers is you have personal triggers, like things that are going within you,
But
like
when you
memories
say
that are,
triggers, you mean triggers to what? What are you triggered to?
okay, like if somebody is going through severe depression and
Yes.
triggers automatically go hand in hand with depression. They can have personal
Mm-hmm.
triggers, what's going on in their mind of events or painful stories that have happened to them. So whatever that memory is, it triggers them to respond angrily or upset because they're having this thought. But when I look at situational, it's something happening outside of yourself. You see somebody saying or
Mm-hmm.
acting in a certain way that you don't
Mm-hmm.
agree with, and it bothers you because you're connecting it with a personal story of yours. And you're saying, I don't like what he or she said or did because I'm relating it to myself. So
Yes,
that triggered me, and I'm getting angry and I'm just taking it, personalizing it. So that's how I'm distinguishing between a
yes. Okay.
personal.
I hear you, and I'm getting triggered listening to you. So I take my glasses off. I
That's
touch
funny,
my
yeah.
nose. These are all cues to say that I'm feeling emotional. I feel scared. I feel. Do you know what I mean? I
Yes.
need to dilute the conversation and take my glasses off in order to
Oh, yeah.
and again back to this methodology, to try and think and feel at the same time, because my experience is that we can think too much and we can feel too much, and that if we think and feel at the same time, we've got, well, twice the chance of getting a better understanding of using both of these information systems to help us. But I kind of go off track a bit, because I think when you talked about triggers, to me the triggers are almost like tiny little bits of trauma.
Yes.
Well, that's reminded me. I'm back to where that was. I'm back to something that I've been avoiding, something that I've been trying not to think about, something that I don't quite understand, something that hasn't settled in my mind or in my brain or in my body. Whoa. And I think the big problem in triggers in depression, okay, I will be more straightforward, that when I get very depressed, I remember other times I've been very depressed. Okay, so I'm triggered to other memories of depression. Okay. Okay, what? Yeah, and you're like, oh, I wonder what those memories are, Andrew. Well, those memories are pretty unpleasant and pretty, what would the word be? Disturbing and distressing, and that, what would the word? There's something. Yes.
Disturbing, distressing,
No. But there's
disruptive.
something here.
How
There's
about
something here as well. Yes,
disruptive?
disruptive. Yes,
It
but
disrupts
hang
your
on,
whole,
because
it ruins your
because
day.
yeah, but we slow down, and I also remember. Okay, but there's a reason why I'm remembering when I get depressed. There's a reason why I remember these other times, because it can be helpful. If I remember how I've dealt with intrusive suicidal phenomena in the past,
Mhm.
then I can do it again.
Yes.
Then I can remember how poorly I've been and kept working, and how poorly I've been and stayed alive. I can remember how poorly I've been and got better. I can remember.
Mhm.
Does it make sense that this is not as novel as it might seem? This is not
Yeah.
as unusual as it might seem, that these triggers can be, well, they can be helpful as well as unhelpful. We can remember
Exactly.
things that are helpful to us. Does it make sense? And so I wouldn't be running away from triggers. And when we
I
try and
always
understand,
say,
them. Does it make sense? In order that,
yes.
go on.
I always say, I have that quote. I think I used it a long time ago. I say triggers are your teachers. They're going to teach you something that you still
Mm,
need to work on, or teach you something that, hey, you're still at this place. You need to get with it and heal it. And that's the next question I have for you is, can you share maybe a couple of strategies with listeners on how you cope with triggers, especially when they lead to intense emotions like anger,
y-
distress, sadness? What are some
yes.
coping strategies?
Yep. And so this happened on the weekend. Here we are. I'm triggered on the weekend, and things
Oh,
this weekend just gone and feeling fairly crazy. And whoa. Well, just as I'm doing right now, I touch my nose, I take my glasses off and clean my glasses. I try and ground myself. I try and slow down. I slow down my rate of speech. I remember where I am. I remember who I am. I remember what we're doing here in order to.
a grounding
In, well,
exercise.
yeah, in order to dilute my experience, in order to, I suppose, try and make sense of it more. Do you know what I mean? The trigger is overwhelming. Okay, so I need to be less overwhelmed. In order to understand this, in order to recover from it, in order to.
Basically, you're saying a good way is a grounding technique, and I know there's so many. What is
Yes, well,
one grounding
yeah,
technique?
but it's grounding for a purpose. It's grounding in order that we can think, in order that we can start thinking again.
Mhm.
So I'm grounding in order, and I can think as well as feel. I've got this strong. I'm triggered, emotionally triggered. Oh,
Yes.
so hang on, right? Well, you need to calm down a bit. You need to, yeah, you need to go for a walk, or you need to lay down on your bed. You need to somehow you need to reduce the amount of stimulus that's going in order that
That's a
you
perfect
can
way of
try and make
saying,
sense of what's just happened. Yes, and
reduce
often
the
it's something I'll
stimulus.
say. I'll say in the therapy when someone's triggered, and I notice. So there's a note. There's a disturbance in the firmament. Do you know what I mean? It's like often I'll say, "Well, what just happened?"
Mhm.
Do you know what I mean? What just happened? When I see someone physically change, or there's a different change in tone, or in the voice, in the body language, or what have you, it's like, well, hang on, what just happened there? Something seemed to shift, or something's different, or something was different. What happened? You tell me about what's happening in order to kind of, I suppose, turn it into words. Do you know what I mean? I do talking therapy, which basically means that talking is therapeutic. So I
Yes.
encourage people to talk, to put into language what is not currently in language. So we're triggered to things that are not currently in language and not currently sufficiently understood and adjusted to in terms of how we consider ourselves and consider the world.
Okay. Yeah, that
Does that
definitely
make
makes
sense?
sense. Yes, it
Right.
does. And I just wanted to share a quote that you've shared.
Mm-hmm.
And you've said that I know sometimes I want to strongly communicate my anger. Now we're going to the subject of anger because that's important
Okay.
in depression. To rid myself of it, to push the anger out of me and onto something or someone else. I know at these times part of me wants to act in dramatic ways, to impact on other people, to get a reaction and feel alive. So we know that unprocessed anger can fuel our depression, leading into a cycle that's hard to break. So,
Mhm.
how do you help patients recognize and manage their anger before it intensifies their depression? Because I know that's a big deal with depression.
Yes, well, yeah, and I suppose the first. Thank you for quoting me. I don't think I've ever been quoted before.
Oh,
Very
okay.
nice.
I
It's a
just
very
thought
nice.
I'd share
It's a
one.
very nice sensation. Thank you. But well, and the first part being is to recognise it. Is to identify together. Well, anger might be part of this situation because for some people, anger is a significant thing in their depression, and for other people, it's not. Does that make sense? It might be it might be
Yes,
the biggest thing, but it also might be really quite minor, and often depending on how anger was dealt with in the family. Does it make sense? If anger's been
it
something that's
does.
been processed healthily in the community, in the family, and in culture where we've grown up, well, when we get angry through depression, well, we know what to do. But if we're from the opposite scenario where anger's been suppressed or ignored or just been turned passive, then when we get all this anger in depression, well, yes, it's going to be a bigger problem. Does it make sense? So
Yes, it
the
does.
first step is identifying, well, this is an issue. And often, well, I don't know, is it 50-50 at the time? A lot of people I meet, I will sit there and I'll be talking to them and my jaw will clench. And literally, I'll be sat there with a clenched
Oh,
jaw, and we'll be having an entirely ordinary conversation like me and yourself are having one now. And I'll find my jaw clenching, and I'll say, yeah, I'm wondering what's happening. My jaw's clenching. Is there anger about? I don't know. There's something, and kind of been curious about it. That being a possibility. That being and your. Well, I really like the way you said it. Unprocessed anger can lead to kind of depression getting worse. That being
it
it's a
can.
possibility. It can. It's a possibility, and even that possibility, like, all right,
Yeah, because you have
and
to
that
have,
well,
I guess you have to have
go on.
strategies in order to work
Yes, yes, yes,
healthily.
but what I'm
Not
saying is
because
first,
there's unhealthy ways to deal with it. We
I
know
know, hang on,
that.
I'm getting to it, Tanya. First of all, we have to see if the jacket fits. Well, does that make sense? Does the idea of anger being a contributory factor to your depression getting worse, maintaining, does that make sense to you? Does it make sense? And if that is the case, if a person's no, that does make a lot of sense. I do find, but do you know what I mean? I would agree that's an issue. Then we start to then move on to get their buy-in. Does it make sense to get their buy-in in terms of, well, okay, so let's think about anger and what would we do? What would we do with unprocessed anger? And what the blog goes on to talk about, yeah, well, what are our choices? What are we going to do with this sensation, this physiological sensation
Yes.
of anger? And I shake my hands literally to deal with it.
Well,
Yes.
I guess that's one
Yes,
good
yes.
way. It's
Well, yeah,
kind of
it is one good way. And of course, and one of the jokes I make about Zoom
movement,
therapy is,
movement,
well, yeah, movement, of course. And
movement.
one of the advantages of Zoom therapy, we can't whack each other, can we?
No.
Do you know what I mean? Literally, we cannot physically attack each other, but that
Yeah.
can be helpful. That can be helpful. It says, oh, well, listen, and I can't physically attack you, and you can't physically attack me, which for some people is really helpful because it means I can get incredibly angry
Yes.
and not reasonably worry about hurting you. Or and the opposite, you
Or
can get
hurting
incredibly
yourself.
angry. Yeah, well, I can hurt myself, can't I?
Yeah.
I can still hurt myself. Yes, but
Self-destructive. Self-destruct.
some people in their anger. Well, this is what my dad used to do. His anger through his depression would be externalized onto us children. Yes, and
Mhm.
so that was. Yes, people deal with it in different ways. Does it make
Yes.
sense? There's this. Yeah, again, I shy away from these long words. With each depression and each trauma, there will be things that are individual to a person, so ways in which they experience it individually, and there will be ways in which they experience it typically. So untypically and typically, that's a better way to put it. So, do you know what I mean? There's a typical way, there's a classic depressive presentation and a classic way to deal with depression. But everybody with depression has their own bit. Doesn't mean there'll be overlapping. There'll be classic things that they do, but also there'll be particular things that they do. And so some things, some tactics, techniques will work, and some won't work.
Yeah, and this
Does
just
it make
brings
sense?
me.
It's the limitation of the diagnosis. The diagnosis is a big tent. Do you know what I mean? In some senses, it's helpful, and in other senses, gets in the way. So it can get in the way. We can, if we only think of our experience as a depression, well, it can also limit us. Or we only experience our sensations as a trauma. It can limit us because it's a singular explanation.
Yeah, because there's another quote you shared too. One more is
Go
you
on.
shared that anger can be a source of information about the situation we find ourselves in. So, in particular, what is important to us in it. In this way, anger can become a motivation to act and change. For example, to develop the skill of expressing anger in bits, assertiveness, in other words. So that's how you, another way that you quoted
Yeah,
it.
yeah. And that being, yeah.
Okay, so Andrew, we're talking about anger fueling depression and how we can deal with it. So, one good way is we talk about emotion regulation. So, if patients are struggling with anger, what are some techniques you find particularly effective of patients that you've worked with? You can maybe share
Yeah,
two or three.
yeah. Well, I used to run an anger management group in a high secure psychiatric hospital.
Oh, good,
Yes,
good.
as you do, yes,
Oh,
yes,
yeah.
yes. Um, and well, emotional. Well, it's interesting, isn't it? Because what you found, it's not what the kind of the popular cultural narrative about people who lose control of their anger is the bloke who is always shouting. He's always shouting or throwing his fists or what have you. And what you find is when you work in forensic mental health, is the person who loses control of their anger entirely is not the guy who's shouting and throwing his fists around. It's generally the guy at the end of the bar. I don't know if you've met this guy or lady at the end of the bar who never really says anything, who keeps
Mhm.
himself to himself, who keeps it all in, and one day snaps. So what
Yes.
we found was the problem wasn't that these guys were expressing anger destructively all over the place, is that they were absolutely closed down. So that either they were denying that they were angry at all, they were dissociating from their anger, or they'd feel it but they wouldn't do anything with it. So they'd hold it all in. And so a lot of the things we would do, it sounds counterintuitive, is encourage them to voice it, to give words to it, to describe it, to what would the word to hold a relationship with it. Does that make sense to own it
Yes.
in some senses rather than deny it? I mean, the other thing would happen in forensic mental health, everyone would panic. Someone says they're feeling angry. Everyone's like, oh my word. And it's like,
Yeah.
no. It's a bit like when someone says, I'm feeling suicidal. Well, it's great, brilliant. You're telling me, and we can talk about it.
Yes. It's
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 much,
hel-
much,
it's healthy
it's
to
healthy.
express.
Yes, it's a much safer thing to do than
Mhm.
not to tell someone we're suicidal,
Then
not to tell someone we're angry.
yeah, to holding it all in, as you said, it bottles
Yes.
up and
Infant,
eventually it pops.
yeah.
I call it
Yes,
pops.
yes, it pops. Yes, exactly.
Mhm.
Which is sometimes we need to hold it in. If we're in an interview or a difficult meeting with our boss, sometimes we've got to keep our lid down. We can't
Oh, of
keep.
course, of course. Yeah.
But after that, we need to go somewhere and let it out. If we're just doing that constantly, that builds up, and this kind of. But what you would again back to the family dynamics. Often, if you grew up in a violent family, and that violence is associated with anger, well, surprise, surprise, we're going to be phobic to anger. We're going to be phobic to our own anger, and we're going to be phobic to other people's anger because, in our experience, anger leads to injury. Anger leads to
Mhm.
violence. Anger leads to significant aggression. And so the idea that we could become angry, feel angry, hear someone else's anger, and that's not going to lead to aggression can be
Mhm.
quite, what's the word? Well, quite liberating. Do you know what I mean? That this is, but you asked me particular tips. But, well, there's,
Or if you can just maybe just one technique you find particularly
My start for 10 would be allow yourself to feel it.
to express it
Just,
healthily,
just, no, just at the start, just to feel it.
to feel it.
Expressing it is the next bit. To feel it, to let yourself feel angry. It's
Mhm.
okay to feel angry.
Yes.
You don't have to act on it. You can be absolutely livid. You can be throbbing with anger, and you don't have to do anything. It doesn't force you to do anything. Do you know what I mean? And that practice, that graded exposure to feeling your own anger without smashing the place up or smashing someone else up or hurting yourself. Right, I get it. Yeah, I'm feeling this. Wow.
Without
Goodness me, this
acting
is
on it.
strong.
That's what
Well,
you're saying.
yes.
Feeling
Yeah,
without the
just,
action.
yeah, but and practice that feeling.
Unless it's
How can
productive. And actually I should say unless the anger you're using it in a productive way to do something positive with it.
this is a skill to experience emotion, to feel emotion without having to act on it is a skill without having to without seeing it as an attack on ourselves or on other people, that it is just an emotion, that it is, well, it's ordinary. We're back to ordinary. This is an ordinary thing. Well, why on earth shouldn't you be angry about being depressed? Jesus, if you're
Yes.
not angry, then again, I'd be much more worried about someone who wasn't angry about being depressed than someone who was, because it is unjust. It does leave us feeling helpless.
Yes.
They're the kind of things we need to be angry about, aren't they? They're the kind of things that need to change. They're the kind of things that are important in our lives and in other people's lives. So that it's. But what a lot of times, I mean, that's what the other part. The other thing I would say is what a lot of people do with their anger who have depression is turn it on themselves.
Mm-hmm.
So kick themselves up
Absolutely.
and down the road. So they blame themselves for their anger, blame themselves for their depression, and you just get into these vicious spirals. Whoa, 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 whoa! Hang on. You can't control the feelings, but we can have an influence on what we do with that feeling. I can feel like I want to kill myself, and I cannot blame myself for that. I can just say, well, that's how I'm feeling today. It's one of those days. This is part of what happens in my brain. This is part of what happens in the world. It doesn't make me good, bad, or indifferent. It just means I'm having that feeling. And it's something, it's not my fault, but it is my problem. Does that make sense as a distinction? And that
Yes.
idea of saying, right, okay, well, it's not anything, nobody wishes depression, nobody wishes flaming anger. But sometimes it comes across us, even though we don't want it. And so, and then it's our job to deal with it. What are we going to do with this?
Okay.
What are
And
we going to do with
also,
it? Go on.
and also, Andrew, so why do you think it's difficult for some people to admit they have depression? And what psychological barriers do you see most
Well,
often?
guilt. Yeah. Well, guilt and shame, of course. Yeah, the stigma
Yes.
of mental health. The idea of well, we call it, I suppose you call it toxic masculinity, but I'm sure there's a toxic femininity as well, where
Mm-hmm.
women are not allowed to have mental health problems, are not allowed to have doubt, not allowed to. Are not allowed to seem weak or to have vulnerability. Whoa.
Yes, that's a good one, actually. That's what you said
But
about
it
they're
feels
not
emotional
allowed
when
to
you
show
say,
weakness.
mm,
Not allowed to
or
show
not allowed. Well,
weakness.
people just don't talk about it. People, I don't know, there's something.
So, in your experience,
Well, we
what are,
have to be
oh,
in
okay.
control. Sorry to mention the cross-channel differences or the cross-Atlantic differences,
No,
but
not
there
at
is
all.
part of the American dream says anything is possible. Well, sorry, I
Yeah.
smile and laugh, of course. Well,
Uh-huh.
because anything isn't possible.
No.
Do you know what I mean? Some things are not within our control. Some
Mm-mm.
things, however hard we try, are not within our compass. There are more powerful forces than us in the
Absolutely.
world. Yes, but that's hard. That's hard, and that speaks against that idea that simply how hard you try is what happens. When we know the outcomes are much more complicated than that. It doesn't say trying's not important, but it does say it's only one factor.
Yes.
It's not simply the hardest workers that get to the top that reap the rewards. Do you know what I mean? It is. Well, we're back to King, aren't we? This idea, we can make a mistake on both ends of the spectrum. We can underestimate our power and still find the world to be helpless and become helplessly dependent on other people or what have you. But we can go to the other end of things and think that we have to be God. We have to be entirely independent. We have to be entirely healthy. And if we're not, then it is a moral failing on ourselves. What's the word? That the world is simple, the world is black and white, and that I'm healthy because I'm good, or I'm rich because I'm good, or I'm rich because I work hard, or I'm healthy because I work hard. Well, yes, and as they say, yes, and it challenges the narrative. Mental illness and all other illness challenges the narrative that the world is fair.
Yes.
What if the
Yeah,
world
that makes
isn't
sense.
fair? What if the world isn't fair? Do we want to know that the world isn't fair? Do you want to know that? Well, no, I don't want to know the world isn't fair. I want there to be karma. I want my efforts to be rewarded. I want, do you know what I mean? My goodness to be held in high esteem, blah, blah, blah. Well, yes, well, all very interesting, but that's not actually the case, isn't it? But it's not a story that people want to hear. People don't
Yes.
want to know.
To hear
People
the
don't want
truth.
Well, yeah, or at least part of the truth.
Yes.
Sometimes, yeah, that part of the truth that we are fragile, that we are vulnerable to illness, and that illness is arbitrary, and whether we respond to treatment or not is arbitrary. That our efforts are only contributory; they're not decisional on our recovery. That we may be ill for the rest of our lives. That we may die prematurely. That life may be particularly unfair to us. Or to people we love through no fault of our own or no fault of their own, just through
but in your
serendipity, or I don't know what you'd call it, randomness, just through the arbitrary nature of existence. Goodness, we're going philosophical now.
Oh yeah, no.
Yes.
So I was just wondering, so in your experience, what is some effective ways to help someone who's reluctant to admit they're struggling with mental health issues like depression?
Talk about your own problem.
That might be kind of hard.
No, it's not hard at all, because
like reluctant.
In forensic mental health, that's exactly what you do all the time.
Oh, they do.
So with people, you do it all the time, and that you talk about you help by example. So with people who are struggling with therapy, I will talk about myself, and I will talk about my experiences. I will talk about how I deal with the world. I will talk about how talking about things helps me. Do you know what I mean? You literally do the therapy on yourself and have the person watch, in order that you can say, well, this is a safe enough place to talk about things. I'm not mad. I'm not out of control. I'm not making myself unwell. I'm not laying on the floor and allowing you to kick me, but I am able to talk about my feelings. I am able to talk about struggle. I'm able to talk about vulnerability. And that being okay and ordinary, and that might even be helpful and interesting, not only to me, but also for you to sit and listen to. Does it make sense? So it's almost like you're selling double glazing, but you're selling double glazing by bringing them to your house that's got very nice double glazing. Yeah, not sit next to the window. There's no draft. Does it make sense? You're wearing the shirt. Do you know what I mean? And this is the.
I like that where you say you're helping by example. You're setting yourself as the person, like in their shoes.
Yeah.
Well, you're more relatable.
This is what's possible.
More relatable.
This is what's possible. This is another way. Yeah, this is another way you can interact with your problems. When you're stressed out, one of the things you can do is go and talk to someone about it. whether it's a friend, whether it's a professional, whether it's a family member, it's something that you can do.
Mm-hmm.
Do you know what I mean?
And
The mental health. Well, we're back to this ordinary. It's not extraordinary to have mental health problems. It's incredibly ordinary. It's not
ordinary.
extraordinary to be ill. Yeah, there's a lovely thing. When I was ill in my 20s, you spend a lot of time when you're ill in your 20s going, "Oh, why me?" And then eventually you get to the point of, "Well, why not me?
Yes.
What makes me so special that I shouldn't suffer from illness? Other people do.
Mm-hmm.
So why shouldn't I?" Do you know what I mean? I'm not. Do you
You're
know what
not.
I mean? I'm no better. Well, I'm no
You're not
better
a
or worse
special
than anyone.
case.
No, and I shouldn't be a special case because
Yeah.
I'm no more important than anyone else.
Mm-hmm.
Yes, it's sad that it happened to me, but it's also sad it happens to other people. Do you know what I mean? This is part of being alive.
Yes.
And
No,
there's
that
lots of
makes
people who
sense.
aren't alive, of course, aren't they? Do you know what I mean? It's
It
that.
makes it
There's,
more acceptable, more normal, because some people not making them feel like it's abnormal or something that's shameful or just horrible, but you make
well,
it
yeah, that's
something
not
that
that's
is normal
yes, that's not well. It's and that it's possible.
and
It's not
normal.
impossible. It's not impossible to have a life alongside mental health symptoms and to have a meaningful life and a good enough life. It doesn't mean we want it. And the same way you get the same with other illnesses, with people with cancer. They'll go, well, yeah. Then people take all kinds of attitudes to it, and just the same. Or the whoa,
So Andrew,
go on.
just for the ending of the interview, if you
Of course.
can share with listeners, if there's just one habit or mindset shift that you can share with listeners who are, if anyone is battling with depression, what would it be? Just one good tip.
So what I say with depression is that to establish what's called a baseline. So most people with depression have good days and bad days. They have relapses, they have remissions. But what I recommend is that people get a baseline. So however bad it is on that day, there's a baseline of things you're going to do in order that we don't go further down, in order that it doesn't become worse. Some activity, some form of self-care, some sort of social contact, some kind of reasonable food, some kind of exercise as the baseline. You are not going to be able to do as much if you're feeling bad, but some kind of baseline that you're going to stick to, right? If it's and on almost bad days, it will be a massive struggle to do those, but it's really important that you do it in order to give you a better chance that it doesn't get worse tomorrow, because that it can always get worse, and maybe that's not as optimistic, but it can, and we can
make it better, right?
not we can make it better. It's
Okay.
important that we try.
Try to make it.
It's important that we try and shift the odds and increase the probability, the likelihood that it will improve. Does it make
Okay.
sense that we do
Yeah.
everything we can, and then we go, okay, well, I've done good enough today. I've done what I
Yes.
can do. I'm really unwell, but I've done what I can do, and I hope that tomorrow is easier. And sometimes getting through, keeping ourselves alive in that day is a massive achievement.
Yes. Survive for the day. And that is a big achievement, depending on where
Yes,
you
and
are.
every week I meet people who are literally surviving for the day.
Yes, I totally understand that. So it's good if you get through that part and then you gradually add
Well, you
your
get
other
yourself.
self-care.
You get yourself another chance tomorrow, don't you?
Absolutely.
Tomorrow's another chance. Whether every day we stay alive, we've got another chance tomorrow, and it may be lighter, it may be more possible. Do you know what I mean? But we don't know. We're giving ourselves another chance.
Absolutely. And I just want to say, Dr. Andrew Perry, thank you so much for sharing all this valuable information with listeners. I'm really grateful for that. And yeah, so thank you for being here.
No problem. Thank you for asking me. I've enjoyed it.
Good. Thanks so much.